How are you?
So we'll do, this is the start of the one for YouTube and Spotify. So healing with Dr. Tom. Okay.
Hi, Ralph. So, welcome to February 19th, 2025. And the energies have just really picked up since the beginning of the year.
You're telling me.
We have a new president-elect, and um, life is changing, right? And on the philosophical piece, we're entering the second quarter of the century. And I wrote a newsletter once saying, a lot of people's anxiety and participations, and they look back and, holy cow, what did I do with the last 25 years of my life, right?
Yeah, that's
And so,
easy.
and that energy is perpetuating, and with the administration pieces and the economic pieces and all the plane crashes and everything else in the world, we're definitely having anxiety. So um, there's a couple techniques that we've talked about in the past. One of them is called neurofascial processing. So if you really want to deactivate the stress system, it's a type of acupuncture where you place your hands on two different spots in the body. And the first spot is always the heart holding here. And then you make a 10-minute connection to your forehead, your belly button, and then your bladder, holding each one of them for 10 minutes. And that really helps to drain the limbic and the hypervigilance system. Then it gets you grounded through the belly button, and then you can let it all go through the bladder. So, heart to forehead, heart to belly button, and heart to bladder is our anti stress and anxiety protocol. And it's definitely since the beginning of the year, I'm a pretty big advocate that we should not eat four different types of food groups. Uh, One of them is gluten, including oats and any grass product. Second one is white processed sugar. Third one is almonds, and the fourth one is peanuts, and they all supercharge and get us antsy with irritations in our system. So um, clients have been coming in and they've been breaking out in severe rashes. Rosacea is when you have this butterfly rash across here. I've had 4 or 5 of those happen this year. I've had another 4 people come into pancreatic cancer. I've had people come in with inflammatory heart disease. And it's basically in Chinese medicine and Ayurvedic medicine, we use 3 tastes to try to numb ourselves up. One of them is sweet, sour, and salty, the perfect McDonald's hamburger. And they feel good. They get us punch drunk for a day or two. And the next day we crave more because we're more in pain and everything else. So that's the anxiety budget here. So we've seen a lot of people with rashes and pieces, and that could be propagated because of the California fires, the irritations that way. So I got a letter this week from a 6-year post, 2018, so 7-year post, cancer-free patient from prostate cancer, had the surgery, and his testosterone numbers are down in that process. So that was one of the rewarding things. And then we had a second one where a client was having um, GERD and a hiatal hernia, and they said that she ruptured her stomach through the diaphragm. And so we set up a protocol with Barb and Marilyn, and we did the work around releasing the diaphragm. And within 3 months, her ultrasounds and CT scans came back like, well, it's only a mild one now. It's not even a hard one that we needed to do a surgical procedure. So those were a lot of the winning pieces in
And
the
that
whole.
is so awesome. And Tom talked about the diaphragm piece. Those are for us real very simple techniques. Simple techniques if you just get your hands, get the IMT hands on you. So and that's a crazy diagnosis. You wouldn't think that that kind of diagnosis could reduce and be better.
Right.
So that's really, I think Sharon Giammatteo and you, you guys should have won the Nobel Prize for the diaphragm techniques. It's like crazy what that
Yeah.
does.
I did it to a professor of a physical therapy school. He goes, "Oh my God, what's this? What's this one?" I just did that like 30 minutes ago on him. He goes, "Oh my God." I said, well, this is what you sat in and I lectured this to you. And he goes, really?
Yeah, I showed it to Bellingham Physical Therapy years ago and they bought the red book and
Yeah.
and it's just it's so simple. And especially for a manual therapist, it's like the simplest technique ever. So but you got to know what to do. I'm gonna give Tom's number because these are desperate times for some people. And if somebody's dealing with a very chronic or crazy or mysterious condition, something where doctors don't have the answers yet, this is a doctor that could help you. 860-561-2286. He's in West Hartford, Connecticut. There's a whole IMT school, and I'm excited to be in winter school this coming next weekend. And man, oh man, Tom. So those are some interesting diagnoses that people don't
Seem
have.
to go away for Western medicine, right? So
Yeah, yeah. So reach out. It's a short podcast today, but it's an important one. And whether you're dealing with anxiety or dealing with some chronic or really strange condition that's one of the tough ones, reach out to Tom. We have this technique called myofascial mapping to find what is causing this thing. And then they can get your plan. And some of the stuff is very powerful and very simple. Like Tom put with the NFP, one hand here, one hand here, one hand here, one hand belly button, and one hand here, one hand on your pubic bone, 10 minutes each. That's a nice way to go at night. And let's take some anxiety out and let's fix people up. As Sharon used to say, just fix them up. Tom, anything else?
perfect, Ralph.
Yeah, perfect. I think this is a good spot. And I'm going to put this on Spotify and YouTube. And seems like it should be a good one for YouTube this time around. And
Okay.
Facebook. Thanks so much. And I look forward to winter school. The runners are going to
Ralph, if you ever want to chat on the other pieces, just let me know. Okay.
I will. Thank you, Tom. I'm going to follow up with what you recommended. All right,
Okay.
you guys. I'm going to go ahead and click everybody off. Thank you, Tom. Say hi to
Bye,
everybody.
Ralph.
Bye.